Welcome to the RVU OMM Mechanisms of Action series. This edition will look at the proposed mechanism of action of articulatory technique. To appreciate this, it is important to have an understanding of the different types of joint barriers within the body unit. So let's begin there. There are three possible barriers. The first is the anatomic barrier. This barrier is the limit of passive motion imposed by the anatomic structure. Moving beyond the anatomic barrier would result in disruption of ligaments, avulsion of tendons, or fracture of bones. Think of Jean-Claude Van Damme or Steven Seagal movies. The second is the physiologic barrier. This barrier is the active range of motion permitted by the joint. If somatic dysfunction is present, then a third barrier occurs, the restrictive barrier. This barrier is a dysfunctional limit that narrows the normal physiologic range. It is the restrictive barrier that is sought out and targeted directly with articulatory technique. So, how does it work? There are several proposed mechanisms. However, they can be grouped into one of two categories. The first is articular and includes restoration of restricted articular motion, release of entrapped synovial folds, disruption of periarticular or articular adhesions, and vacuum theory or cavitation. The second is resetting aberrant nociceptive and mechanoreceptor activity. The articular mechanism addresses a restrictive barrier, regardless of cause, by engaging it and applying a direct, repetitive force without impulse or thrust within the physiologic range of motion. This action progressively resolves the restrictive barrier, restoring motion within the physiologic barrier range. The nociceptive and mechanoreceptor mechanism relies on the Golgi tendon organs, which monitor tension and muscle force. The Golgi tendon organs lie within muscle tendons. Afferent group 1B sensory nerve fibers carry the impulses from the Golgi tendon organs to the spinal cord, which then affect the alpha motor neurons of the same muscle via interneurons. This allows the Golgi tendon organ to inhibit muscle contraction when it senses excessive tension of the monitored muscle to prevent muscle injury. When the joint is brought into the restrictive barrier repeatedly with articulatory technique, the Golgi tendon organ senses the tension of the muscle and a signal is sent to inhibit the contracted muscle, which leads to relaxation of the muscle, resolution of the restrictive barrier, and restoration of the physiologic range of motion. All right, so now you know how articulatory technique works. And remember, as A.T. Still says, an osteopath reasons from his or her knowledge of anatomy and physiology. This has been an episode of the RVU OMM Mechanisms of Action series.